Last night we had our SPPC meeting, our Strategic Priorities and Planning Committee meeting. It's basically a committee of the whole, and I'm pleased to report that councillors voted, excuse me, unanimously last night to support 9 additional COVID-19 relief measures. Just a few highlights here. It includes fresh food delivery for low-income Londoners in quarantine or in self-isolation. We've expanded a $10 a month internet program to tenants at social and public housing units. We're providing an extra $325,000 for the Housing Stability Bank to help cover rent and utility arrears. And we're deferring rent payments for 60 days for city-owned properties. Now, a number of those measures, interestingly, came out of the Mayor's Economic Impact and Recovery Task Force and Social Impact Task Force. So I was pleased to see the unanimous support from my colleagues last night. The measures are in addition to actions that we previously approved to include 60-day property tax installments, as well as 60-day interest-free deferrals for all community improvement plan loan repayments. So in the meantime, we're trying to stay in really close contact with provincial and federal government ministers about how best to support Londoners and London businesses as they work through the COVID-19 pandemic. Second quick point. The province of Ontario is now allowing community gardens to open. So that means preparations are now underway here in London to physically prepare our own local gardens and to identify appropriate guidelines for gardeners this season. We will take some direction and work through the Medical Officer of Health for any advice that his office provides. But our plan is to open the city's gardens as soon as possible, and we'll share that once that's been confirmed. We do know, though, it won't be ready May 1, as is usually the case, so we're asking people to please avoid going to the gardens until we've confirmed that they're open. The gardens can't open until all measures to slow the spread of COVID-19 have been identified, are in place. But again, those preparations are underway, and we hope to have an opening date announced soon. So thank you to all. I think this is some nice news, important news. And at some point, I'll be sharing some big news about the food bank. But for now, this is what we wanted to share this afternoon. Over to you, Chris.
Very much, Mr. Mayor. I always appreciate your comments. Let's start with the numbers. We had just 9 new cases reported in the Middlesex-London Health Unit area in the last 24 hours. Unfortunately, we also had 4 deaths reported. Mr. Mayor, I have to apologize. The briefing I gave you this morning had only 3 deaths. We've identified an additional death since that briefing, so 4 deaths have been identified over the last 24 hours in the London and Middlesex area. Provincially, the latest numbers continue the trend at a significantly increased disease rate that does continue to drop. We had 347 cases reported across the province in the last 24 hours. That's the lowest number for well over 2 weeks. We haven't been below 400 very often in April. So very happy about that improvement. In terms of the death counts provincially, those continue on at a fairly high level, and there were 46 deaths reported provincially in the last 24 hours. One issue we talked about yesterday was the toll that this work has been taking on people working on the front lines in healthcare and elsewhere. We also saw recently a significant release of a poll of 1,900 people across Canada, which identified mental health as a major issue during the coronavirus outbreak. 50% of Canadians in this poll indicated that their mental health had deteriorated in the time since coronavirus began to affect Canada. This is very concerning. There were only something like 7% of people that saw an improvement in their mental health, 50% showing a decline in their mental health, and the balance, no significant change. This is something that we had identified early on, and we know that the measures that we are all taking that are so important in terms of the physical distancing can also be socially isolating for many of us. And it's, natural, human, and good to seek that human contact with others. And of course, when we miss that, it really can take a toll on our mental health. There's certainly no magic bullet. We know that connecting by video can help. It's not the same as getting a hug, but there are also other things that you can do on your own. I actually went through a significant period of isolation in 2017. I had a concussion. I was off work for about 5 months. And isolation was a significant part of what I needed to do for recovery. And some of the things that I really never thought I'd get into became staples in my lives. First of all, meditation. I found a great app on my phone that is really helpful. It's called Insight Timer. It has thousands of meditations from thousands of leading experts around the world. There are lots of great meditation apps. Insight Timer is the one that really worked for me. I also found that you could get programs that would give you yoga practices, some for free and then some using the freemium model where you pay a bit extra for more features. But Down Dog was one that really helped me to center myself, connect my mind with my body, and bring myself back into my body in a way that helped to get above the mental struggles that I had recovering from the concussion that I had in 2017. Getting daily aerobic exercise. My dad actually bought me a cheap bike for Canadian Tire that we put in my attic, and I would ride that for building up to 20 minutes a day. Started out 5 minutes and added 1 minute a day, and I found that pretty soon I could see the difference if I happened to miss a day of that aerobic exercise. It really had an impact on my mental health. If you don't have room for an exercise bike, it might be walking the stairs, it might be going for a walk in your neighborhood, as long as you can do so safely without compromising physical distancing. But aerobic exercise can really improve mental health. So those are the three things that ended up being crucial for me. I also ended up getting into books on tape sort of thing, listening to audiobooks. It doesn't have the same sort of visual stimulation, which actually can allow your mind to rest and recover even better. And for concussion recovery, the best thing for me was to go over books that I already knew, that I'd read before, and just experience those again. But for others, there's a whole world of books available through London Public Library, through Middlesex County Libraries, and there are apps that can bring those books right to you. You don't have to even leave your home to get access to them, as long as you have internet. Hoopla and Libby are the two phone apps that our London Public Library system uses and promotes. So, mental health not to be forgotten in this important time. We've had over 2,000 deaths in Canada due to coronavirus, but suicide kills over 4,000 people in Canada every year as well. So something we absolutely need to be considering and putting in front of mind. Please do take the steps you need to take care of yourself and your family and your loved ones. That's it for me today, Dan.
All right. Thank you very much, Dr. Mackie. Thank you, Mayor Holder. We do have questions coming in, so we'll get to those right away. Dr. Mackie, the first question is for you. It's from Dan Brown at the London Free Press. And I'm not sure if you have this information at your fingertips, but Dan would like to know, of the 4 COVID-19 deaths that the health unit is reporting today, how many were being treated in intensive or critical care?
Yes, I can tell you that the cases were all linked to, 3 of the 4 cases were linked to homes, 2 to long-term care, 1 to a retirement home. The 4th case was not a resident of a long-term care home or retirement home, and that person did pass in the intensive care unit in a London hospital.
All right, thank you very much. And a follow-up question, Dr. Mackie. What does the relatively stable COVID-19 hospitalization data at LHSC tell us about the pandemic fallout in London and in Middlesex County?
And no doubt that the pandemic is having an impact in healthcare in London and Middlesex County. It's great that we have been able to see those numbers stabilize. The main thing that tells you is that the people in London and Middlesex have been doing a great job of respecting those public health measures, distancing, closures, etc. And so that's really, a credit to the people of this region. Healthcare is great when you're sick, but it doesn't usually prevent you from getting sick. So the reason we've been able to keep those numbers low is because the public has been so helpful and cooperative with the public health measures.
All right, thank you very much. Dr. Mackie, the next question, also for you. It is from Dan Brown again. Is community transmission of COVID-19 low, with long-term care and retirement homes primarily driving the daily number of new cases? So that is the question. Is community transmission, I guess, not necessarily low, but is it lowering?
Yeah. Well, so this is something where we would love to have better data than we do. What we do know is that there are many cases of the community that are going undiagnosed. We just don't know how many. The push right now to make sure that everyone in long-term care is diagnosed is really where our new diagnoses of cases are happening. It also, though, does align with the death data as well. We're seeing at this point in the pandemic, the majority of deaths coming from that same area, from long-term care and from retirement homes. So that suggests that at least for the serious cases and for the cases that are being diagnosed, it is in the homes that we're seeing the most activity. We essentially don't have a good answer for how much activity there is in the community right now. What you haven't really seen in Canada, there have been a few studies elsewhere, but you haven't seen a random sample of people being tested in Canada outside of the healthcare system. So you've got basically a selected group of people who are sick and deem themselves sick enough to get tested that are coming in and getting tested. Whereas you don't have, a random sample of, say, 500 people in the London Middlesex area, sampling all of them, whether they have symptoms or not. That would be the sort of study that we would need to answer the question of how much transmission there really is in the community versus how much transmission is just happens to be caught by the testing systems that we have in place at this point.
All right, thank you very much, Dr. Mackie, for that answer. The next question, Mayor Holder, is for you. It comes from Sawyer Bogdan at Global News Radio AM 980 CFPL. Mayor Holder, this is a question that they received from a listener. The listener would like to know if you will allow open air burning, saying that fire crews have not been as busy as predicted. This person said that rural areas are building up on brush and dead trees, and it's a nice, enjoyable thing to do with families who are stuck inside. So the question, I think, is, will you allow open air burning of brush this spring?
The jurisdiction it really emanates from the fire department. So the fire chief is well aware. There have been a number of people, not just in the rural area, but inside London, that would like to be able to burn leaves and do some of these things as part of their spring cleanup. I would suggest initially part of the concern had to do with staffing around resources needed for issues around, be it COVID, and more specifically, if there were some challenges about less staff available as a result of COVID. So I know that the fire chief's considering this right now, and when a decision other than no comes up, we'll make sure that we report that back through as well.
All right, thank you very much, Mayor Holder. Gentlemen, that actually takes care of the questions that we had in the queue this afternoon. We'll give folks just a moment if they would like to get more questions in. But just wondering if either of you would like to say another word before we prepare to sign off for today's media briefing.
Well, one thing that I've been curious about, Dan, and perhaps our media could give us some feedback either through yourself or through today through the question and answer section. But we see in the not too distant future, we will likely be at a place where the daily briefings aren't required anymore. I don't think we're there yet, but I think we're getting close. And I'd love to have any feedback that our partners in the media might have on that issue.
All right.
And I have...
Absolutely.
Dan?
Go ahead, Mr. Mayor.
Yeah, Dan, I have no further comments as well. Thanks very much for the questions that were asked.
All right. So for our folks who are tuning in, members of the media, you can send your feedback as to how you are finding the daily virtual media briefings, if we should continue on a daily basis, maybe move to a few days a week instead of daily. You can email me with your comments at dan.flaherty@mlhu.on.ca. I think it's the email address most of you have anyway. And you can also reach me on my cell phone, which I think most of you have as well. So that's it for today, gentlemen. Thank you very much for your time, as always, and for the information you're sharing to keep the community up to date. Thanks for tuning in, and we'll see you tomorrow at 2 o'clock. Have a great rest of the day.
Thank you.